now. We have some steps you can take for good health, and these are important for everyone. So go ahead and walk us through these, doctor.
So I think the first one here, being socially and spiritually active.
Oh, I like that's the first one. Let's do that.
It just reminds us that this is not just the heart, but it is overall health and well-being, and that starts with the mind and to some extent the soul, depending on your belief system.
And find your thing, right? Like maybe your thing is singing or whatever kind of releases those endorphins, right?
Exactly, and the data is that people who stay engaged in their community, whether it's in church, in activities like singing or what have you, do better, and oftentimes that's through social contact. But also here you see you have to take charge of your blood pressure. That means a few things. You have to know your blood pressure, so it has to be checked. As we talked earlier in the show, you can't simply divine your blood pressure, so you have to not be afraid to know your numbers. The cholesterol has to be also checked, and that is a blood test. Tracking your blood sugar usually starts with a blood test. And these, as you can see from the earlier segments in the show, are all parts of the risk factors for heart disease. The other steps listed here, enjoying regular exercise. I think that verb enjoy is important. So you have to find something that you enjoy, that you like. So something that you can do as a family, whether it's a bike ride after dinner or yoga on the weekends. Eating healthily, as we talked about a lot during this segment. Stopping smoking, one big thing to try to do today. If you smoke, really try to put those cigarettes away. And managing your weight. It doesn't mean achieving perfect weight. It just means working to limit weight gain and gradually reducing your weight.
Okay, if you're someone who's at average risk for heart disease, how often should you be going to the doctor to get your numbers checked?
You know, probably once a year for the average risk person. If there are problems that are identified or require follow-up, then the doctor will set the frequency of the follow-up. So some of our heart patients we see every 3 months, occasionally more frequently than that. And when people are stable and on a good regimen and don't have a lot of fluctuation in their risk factors, we can see them every 6 months or so.